Imagine this. You walk to your mailbox on a Tuesday afternoon. There's a letter from your Medicare Advantage plan. You tear it open, expecting maybe a premium notice or a routine update. But the letter says something else entirely. It says your plan is leaving your area. Effective January 1st, your Medicare Advantage coverage is terminated. You need to find new coverage. Your stomach drops. You've been on this plan for 8 years. Your doctors are in network, your prescriptions are covered, and now just like that, it's gone. You think, okay, I'll just switch to original Medicare and get a Medigap supplement. Millions of people do that, right? So you call an insurance company and the agent asks you a few health questions. Do you have diabetes, heart disease, any history of cancer? You answer honestly. And then the agent says, I'm sorry, we're unable to offer you a policy at this time. That is happening to real people right now, in 2026. And if you don't know your rights, it could happen to you. Hello, I'm Jocelyn. I'm a senior policy analyst and retirement finance expert, and this channel exists for one reason: to make sure you understand the rules that protect your benefits before someone else uses those rules against you. Here's what I'm going to do in this video. I'm going to explain exactly what's happening with Medicare Advantage plan terminations in 2026. I'm going to walk you through the federal rights you have to get Medigap coverage even if you have a pre-existing condition. And I'm going to show you the one mistake that locks people out of supplemental coverage permanently. Because here's what most people don't realize. The problem isn't that you can't get Medigap, the problem is that you have a very specific window to get it. And if you miss that window by even 1 day, insurers can legally deny you. So let's talk about what happened to a man I'll call Robert. Robert is 69 years old. He lives outside Atlanta. He's been on a Medicare Advantage plan through a major national insurer for 6 years. In September of 2025, Robert got a letter. His plan was not renewing its contract in his county for 2026. The letter told him he'd be automatically enrolled in original Medicare starting January 1st if he didn't pick a new plan. Robert figured he had time. He was busy with the holidays. He told himself he'd deal with it in the new year. January came. Robert was now on original Medicare Parts A and B, no supplemental coverage, no Medigap, no Medicare Advantage. In February, Robert went to the doctor for a routine visit. The bill came. He owed 20% of the approved amount out of pocket. That's how original Medicare works without a supplement. There's no annual cap on what you can owe. So Robert called around to buy a Medigap plan. Plan G, the most popular option. The first insurer asked about his health history. Robert has type 2 diabetes and takes blood pressure medication. He was denied. He called a second insurer, denied again. He called a third. They offered him a policy, but with a 6-month waiting period for anything related to his pre-existing conditions and a premium 35% higher than the standard rate. Robert didn't understand. He thought Medicare meant he couldn't be denied coverage. And here's the thing. Robert actually had a legal right to buy Medigap without any medical underwriting. His plan had terminated. That triggered what's called a guaranteed issue right. He had 63 days after his coverage ended to apply, and no insurer could deny him or charge him extra. But Robert didn't know about the 63-day deadline. He didn't apply in time. And by mid-March, that window had closed. Robert's mistake wasn't a lack of effort. It was a lack of information. And that's exactly why I'm making this video. Let me walk you through the rules. All of this comes directly from Medicare.gov, the Kaiser Family Foundation, and AARP. No rumors, no speculation, just the actual policy. The scale of the problem first. Let's understand how big this is. According to a study published in JAMA in February of 2026, approximately 2.9 million Medicare Advantage enrollees, roughly 1 in 10, were forced to find new coverage this year because their plans exited or reduced their service areas. If you live in a rural area, that rate was approximately double the urban rate. And according to Kaiser Family Foundation data, about 90% of Medicare Advantage enrollees over 65, that's around 22.4 million people, do not currently have guaranteed issue protections for Medigap outside of their initial enrollment window. So this is not a small issue. It is one of the largest disruptions in Medicare coverage in years. The core rule, Medigap open enrollment. Now, here's the foundation you need to understand. Federal law gives every person turning 65 a one-time 6-month Medigap open enrollment period. It starts the first month you are both 65 or older and enrolled in Medicare Part B. During those 6 months, any insurance company that sells Medigap in your state must sell you any policy they offer. They cannot deny you. They cannot charge you more because of your health. They cannot impose a waiting period for pre-existing conditions. This is your golden window. And for most people, it only happens once. After that 6-month window closes, in 46 out of 50 states, Medigap insurers can use medical underwriting. That means they can ask about your health history, deny your application, or charge significantly higher premiums. Only 4 states, Connecticut, Massachusetts, New York, and Maine, require some form of continuous or annual guaranteed issue access for people 65 and older. What happens if your Medicare Advantage plan drops you? Now here's the critical part for 2026. If your Medicare Advantage plan terminates its contract, exits your service area, or stops offering coverage, federal law gives you a guaranteed issue right. This means you can buy a Medigap policy, specifically plans A, B, C, D, F, G, K, or L, depending on your eligibility, and the insurer cannot deny you or charge you extra because of any health conditions. But there is a deadline. You must apply no later than 63 days after your Medicare Advantage coverage ends. You can actually start the process up to 60 days before your coverage ends. So the full window is roughly 60 days before to 63 days after. That is your protected period. If you miss that 63-day deadline, you lose the guaranteed issue right. And in most states, you are then subject to full medical underwriting. The first-year trial right. There's another protection you should know about. If you joined a Medicare Advantage plan for the first time and you've been enrolled for less than 12 months, you have what's called a trial right. You can leave the Medicare Advantage plan, return to original Medicare, and buy any Medigap policy with guaranteed issue protection, no health questions asked. Similarly, if you previously had a Medigap policy and dropped it to join Medicare Advantage for the first time, you have 12 months to change your mind, go back to original Medicare, and get your old Medigap policy back as long as the same company still sells it. The numbers you need to know for 2026, the standard Medicare Part B premium is $204.40 per month. The annual Part B deductible is $283. And here's what makes Medigap so important. Original Medicare by itself has no annual out-of-pocket maximum. If you have a major hospitalization or surgery, the 20% coinsurance on Part B services alone can add up to tens of thousands of dollars with no cap. Medigap fills that gap. Without it, you are exposed to unlimited costs. Additional state protections. Beyond the federal rules, many states offer extra protections. 35 states provide additional guaranteed issue rights based on qualifying events such as losing employer coverage or losing Medicaid. 9 states have what's called a birthday rule, which gives you a window around your birthday each year to switch Medigap plans without underwriting. And starting August 1st of 2026, Minnesota is adding an annual guaranteed issue period for residents ages 65 to 70. So depending on where you live, you may have more options than you think. All right, here's exactly what you need to do if your Medicare Advantage plan dropped you or if you're thinking about switching to Original Medicare. Step 1. Verify your current coverage status log into Medicare.gov or call 1-800-MEDICARE. That's 1-800-633-4227. TTY users can call 1-877-486-2048. Confirm your current enrollment. Make sure you know exactly when your Medicare Advantage coverage ends and when your original Medicare coverage begins. Write down those dates. They determine your 63-day window. If you received a termination letter or a notice of non-renewal from your plan, keep that letter. Do not throw it away. It is your proof that you have guaranteed issue rights. Step 2. Contact SHIP before you buy anything. SHIP stands for the State Health Insurance Assistance Program. It's a free government-funded counseling service that helps Medicare beneficiaries understand their options. You can find your local SHIP office at shiphelp.org. A SHIP counselor can tell you which Medigap plans are available in your state, confirm whether you qualify for guaranteed issue rights, help you compare premiums, and walk you through the application process. This is free. Use it. You should also check your state insurance department for any additional protections. You can find that at content.naic.org, State Insurance Departments. Step 3. Apply within your window and keep copies of everything. If you have guaranteed issue rights, apply for Medigap as soon as possible. Do not wait until the last day. Processing can take time, and if your application isn't received within that 63-day window, you lose the protection. When you apply, keep copies of every document. Your Medicare Advantage termination letter, your Medigap application, any correspondence from insurers. If you apply by phone, write down the date, the name of the person you spoke with, and a summary of the conversation. If an insurer denies you and you believe you have guaranteed issue rights, file a complaint with your state insurance department immediately. You have legal protections, but you need documentation to enforce them. Let me also mention the key deadlines one more time because they are that important. If your Medicare Advantage plan exits or terminates, you have 63 days after your coverage ends to apply for guaranteed issue Medigap. If you're within your first 12 months of Medicare Advantage, you can leave and buy Medigap at any time during that year. The Medicare Advantage open enrollment period runs January 1st through March 31st, and you can make one plan change during that window. And if you missed all of these, check your state's rules because you may still have a qualifying event right or a birthday rule window. Now, here's what worries me. The rules I just explained, they're not complicated, but they're buried. They're scattered across Medicare.gov publications, state insurance regulations, and federal code. Most people don't find out about them until it's too late. That's why I built this channel. And that's why I'm asking you to do two things right now. First, if you know someone on Medicare Advantage, someone who might be affected by these plan exits, please share this video with them. Send it in a text, post it in your family group chat, email it to a friend. This information could save someone from financial disaster. Second, join the Global Senior Alerts WhatsApp channel. The link is in the description below. When you join, you'll get a free downloadable senior benefits protection guide that covers Social Security, Medicare, Medigap deadlines, pension rules, and more. You'll also get real-time alerts whenever a major rule change affects your benefits. No spam, no sales pitches, just the information you need when you need it. Because here's the truth. The system isn't designed to make this easy for you. These enrollment windows are narrow, the paperwork is confusing, and with the staffing cuts at Social Security and Medicare right now, you can't always get someone on the phone to help. But you are not powerless. You have rights, you have deadlines, and now you have the information. I'm Jocelyn. Thank you for watching. Please subscribe, hit the notification bell, and I'll see you in the next one. Take care of yourself.